So today we're going to talk about abuse of major stimulants. So this is part of a series of lectures on abuse of drugs. So generally when we talk about stimulants, they are drugs that cause elevation in mood. It produces feelings of well-being. It makes you feel better and you feel happy. So this is a news from Yahoo, where a drug mule carrying 60 cocaine-filled capsules in his stomach was detained at the Penang International Airport in Malaysia. So he was arrested on arrival from Singapore. And they searched him but didn't find anything, and they decided to do an X-ray, and they detected 60 capsules inside his stomach. So this is a typical news about how a stimulant that is very popular, that is cocaine, which is commonly brought into Malaysia from other countries by foreign nationals. So these are the three main stimulants. We have caffeine, cocaine, and also amphetamine. So caffeine is a very popular stimulant. It is also highly addictive, and you may get physical and psychological dependence after as little as 100 milligrams per day. And heavy use will lead to restlessness, feeling nervous, feeling very excited, insomnia, cannot sleep, your face becomes flushed with muscle twitching, you might have rapid heartbeat, palpitations, increased in urination, and also gastrointestinal symptoms. And at the dose of 10 grams, you might get convulsions, respiratory failure, and also death. And abrupt withdrawal causes irritability, headache, and restlessness for up to a week. So this is quite a high dose, 10 grams, so it's not that easy to overdose on caffeine. So it's generally a safe drug. But if you take too much of it, so these are some of the potential adverse events that can happen when you take an overdose of caffeine. So even for caffeine, you need to take in moderation. So commonly these are the substances that contain caffeine: tea, coffee, chocolate, and also carbonated soft drinks. So look at this, the amount of caffeine per cup. So even decaf coffee has some amount of caffeine in it. And then hot chocolate, contrary to popular belief, it contains caffeine. And then green tea, espresso, a can of cola has about 40 milligrams of caffeine. And black tea has got caffeine. Then obviously Red Bull contains a high amount of caffeine, 80 milligram. And then it's instant coffee, it's got caffeine, and also of course brewed coffee has got a high amount of caffeine. in it. And the next stimulant of the caffeine is amphetamine. So this is the general name given to a class of synthetic drugs that have similar effect to adrenaline. And amphetamine, it acts by releasing noradrenaline and also dopamine, and also by inhibiting their reuptake, and also probably by direct agonist action on receptor sites. So by releasing noradrenaline and dopamine, and also by inhibiting their reuptake, and probably by direct agonist action on receptor sites, we see the effects of amphetamine, which has similar effects to adrenaline. So amphetamine is a powerful central stimulant. It causes elevated mood, makes you become energetic, makes you more alert, become more confident in yourself, reduces feelings of hunger and fatigue, increased talkativeness, restlessness, and also probably agitation. So you might become more agitated when you take amphetamine. And you also might become more anxious and irritable when you take amphetamine. So sympathomimetic effects, as we have mentioned, that it causes effects that are similar to adrenaline. So obviously it causes increase in heart rate and blood pressure, palpitation, your pupils become dilated, you might develop dry mouth, sweat, you become sweating. Ignore this is a mistake. And then we have acute intoxication. When you are intoxicated with amphetamine. Usually intoxication is a term that is more commonly used for alcohol, but it's sometimes used for other drugs too. So we talk about acute intoxication with amphetamine. Causes dizziness, become dizzy, you might become sweaty and chest pain, and you have palpitations, increase in blood pressure, you might develop cardiac arrhythmias, the temperature might increase, and also potentially you might develop convulsions or fits. So tolerance to the effects of amphetamine. So you can develop tolerance to the euphoric effects, the mood elevation effects, and also you can develop tolerance to cardiovascular effects, and also tolerance to the appetite suppressing effect. So when you develop tolerance to the effects of a drug, you will require a higher dose in order to attain the same effects of a drug. Okay. So over some time of taking amphetamines, you will need a high dose to reach euphoria, to have an effect on your blood pressure, heart rate, and also in order to suppress your appetite, to get the effects of appetite suppressing effects of amphetamine. You will need a higher dose in order to achieve that after taking amphetamine for some time. So amphetamine is also useful for narcolepsy, okay, and also ADHD, attention deficit hyperactivity disorder, and it might reduce the antisocial behavior of patients with ADHD, and it can also increase their attention span. Can patients or can people who take amphetamine develop tolerance to, can they develop physical dependence to amphetamine? As we know that there are two types of dependence. You have psychological dependence and also physical dependence. So this is a controversial issue. But abrupt withdrawal will lead to fatigue, depression, hunger, need for sleep, or which is called, the whole thing is called the crash, because after being very, very active and very, very alert for many, many hours or days, so it is understandable that you will develop fatigue, depression, hunger, need for sleep, etc. So people are not sure whether these are the effects of withdrawal, or it's just a physical condition that you are in after not eating for so many hours or days, and also not sleeping, and being too alert for too many hours or days. So obviously you might become fatigued, feel hunger, feel a need for a lot of sleep. So that's why we're not sure about it, whether there is a thing that we can call physical dependence with amphetamine. So psychological dependence has been observed, and we noticed that chronic users of amphetamine, they develop intense craving, and they also have the typical drug-seeking behaviors of other drug abusers. And this might happen, for several weeks. So an adverse effect of amphetamine is it causes a psychotic illness, which is difficult to differentiate from schizophrenia. So they might develop paranoid delusions. And so, by the way, delusions are false, unshakable beliefs that are not shared by people from the same cultural background. Okay, and then they also might develop auditory and visual hallucinations. So they might see things that other people cannot see, and they might hear what other people cannot hear. Thus hallucinations, hallucinating. Okay, we will continue in the next video. Thank you.